this is Cecilia Carmen. This is my advocacy plan presentation, and the topic is opioid epidemic in Douglas County. The purpose of this paper is to discuss the opioid crisis impacting Douglas County in Nebraska. The initial portion of the paper will discuss data related to the opioid crisis in Douglas County and what is currently being done within the community to combat this crisis. Lastly, a summary of 2 alternative ways to address the opioid crisis in Douglas County will be discussed. Section 1, Statement of Public Problem. Opioid addiction is on a constant rise throughout Douglas County. This is a community epidemic that is on the verge of a crisis. Douglas County is fighting to combat this epidemic and to save lives. To start out, it should be mentioned that, according to the Women's Health Advisory Council, Nebraska Department of Health and Human Services has not declared an opioid crisis. Rather, is approaching the opioid issue with evidence-based practice and prevention and is strengthening treatment and recovery efforts across the state. This is not specific to Douglas County alone, but covers the state and all the counties within the state as a whole. Another component is that this may not be considered an opioid crisis in Nebraska at this time, but without proper intervention, it will be a crisis, and many lives will be lost to potentially fatal drugs. According to the National Institute on Drug Use, in the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and healthcare providers began to prescribe them at greater rates. This subsequently led to widespread diversion and misuse of these medications before it became clear that these medications could indeed be highly addictive. Additionally, it is also mentioned in the same report that the Midwestern region saw opioid overdoses increase by 70% from July 2016 through September of 2017. Now that it is established that the thought of the opioid crisis started with the pharmaceutical companies, it's fair to estimate that this has been an ongoing issue for nearly 30 years. Many individuals are impacted by the opioid crisis, and the ages vary. As indicated earlier, this paper will focus primarily on Douglas County, reporting specific data. According to the Women's Health Advisory Council, Douglas County Health Department is considered a high-burden area for treatment of opioid-related medical issues. The PowerPoint also breaks down the number of opioid-related deaths in Douglas County from 2006 to 2015, separated by gender. According to this report, approximately 210 females died from opioid-related overdoses in this time period, and approximately 240 males died from opioid-related overdose in the same time period. Next, the same report located in the PowerPoint from the Women's Health Advisory Council distinguishes between opioid-related drug overdoses leading to death according to the individual's age at the time of death. The report indicates that, in Douglas County alone, from 2006 to 2015, just over 30 deaths occurred in the age range of 15 years to 24 years of age. This report continues to break down the death within the same date range of 2006 to 2015 according to age as follows. There were just over 70 deaths in the 25 to 34 year of age range. Next, there were approximately 110 deaths in the 35 to 44-year-old age range. Then, there were 140 deaths in the 45 to 54-year-old age range. And lastly, there were just over 100 deaths in the 55-year-old and older age range. There is a small margin of unknown age range that would be approximately 7 to 10 deaths. According to this chart, In comparing Douglas County to other counties within the state of Nebraska, Douglas County has one of the highest death rates according to age. Another comparison that is extremely important to discuss is the number of deaths related to specific drugs in Douglas County. The data from this report is also from the Women's Health Advisory Council, and the time period is again from 2006 to 2015. According to the data, opioid pain relievers, including methadone, caused 54.6% of all deaths. Heroin was the cause of 2.2% of deaths. Cocaine was the cause of 8.8% of deaths. Benzodiazepines were the cause of 18% of the deaths. Psychostimulants with the abuse potential, including methamphetamines, caused 11% of the deaths. And lastly, and also the highest rate, other unspecified drugs were accountable for 66.9% of deaths in Douglas County. Next, we'll break down the number of deaths according to race or ethnicity. There is limited data provided by the Henry J. Kaiser Family Foundation indicating that of the 59 opioid-related deaths in Nebraska in 2017, 52 of those deaths were Caucasian. There was non-specific data reported on Hispanic and African American races. Services for both healthcare professionals and those at greatest risk for opioid overdose are growing in Douglas County. Some of the programs available are located at Douglas County Health Center. The hospital is primarily dedicated to indigent individuals. Services provided through Douglas County Health Center are psychiatric services, inpatient psychiatric services, and detox programs. There are several ways in which Nebraska is combating the opioid crisis. One way is through the increased education of medical providers that prescribe opioids. Providers are educated on alternative means for pain management and are often encouraged to refer patients to pain clinics to assist patients in managing chronic pain without the use of opioids. Another extremely important factor against the opioid crisis is Nebraska's prescription drug monitoring program. According to the research article, The Opioid Epidemic, Nebraska's Response to the National Crisis. Each program is an electronic prescription drug database. The database collects information entered when the pharmacist or their designee dispense an opioid prescription. That information is then available to physicians and other authorized users. Another way Nebraska is increasing support is the enhanced access to naloxone to users, friends, and families of users, police officers, EMT providers, school nurses, and in healthcare offices. Some of the other ways in which Nebraska and its partners, also combating the opioid crisis, work together to meet the same goal of making Nebraska a safer place for all individuals. As mentioned in the research article, The Opioid Epidemic, Nebraska's Response to a National Crisis, the focus is multidimensional. It combines prevention, which includes prescription drug takeback, prescription drug overdose prevention, dose of reality educational campaign, broader access to naloxone, as mentioned earlier, and laws that regulate how prescriptions for opioid medications are prescribed. Another part of the plan for combating the opioid crisis is through treatment. This includes encouraging physicians to prescribe alternate medications so that patients can start their recovery process. In addition to educating healthcare providers in evidence-based practice in the treatment of individuals with a history of opioid use. Lastly, according to the research article, The Opioid Epidemic, Nebraska's Response to a National Crisis, Nebraska has identified a potential plan for helping addicts and providers when help and resources are needed. These are identifying risk factors for opioid addiction, recognizing an overdose, means for access for treatment for drug addiction, in addition to several numbers of resources when seeking assistance for addiction. Overall, the state of Nebraska is proactive in the fight against the potential opioid crisis. Douglas County appears to be a county with a high rate for adverse effects from opioid use. as described earlier. This is shown and much is being done locally and at the state level to combat the opioid crisis, and it appears that the fight to correct this public health issue is a continuous battle that is evolving daily with the implementation of new programs and legislature. Next, we will discuss alternative ways in which Douglas County can combat the opioid crisis. The first program that could potentially aid in the fight against the opioid crisis in Douglas County is an extension of a program that is currently being implemented in Douglas County. Healthcare providers in Douglas County are offered the opportunity to participate in online trainings, but are not required to complete these trainings. If healthcare providers were required to complete this training as part of their employment or as part of maintaining their licensure, it would extend valuable education to all providers. This could potentially reach providers that fall between the cracks, that are reluctant to learn new standards of care when treating patients. It is also an excellent opportunity to refresh their knowledge so these providers can treat patients more effectively and safely, and better educate their patients, staff, and organizations. It would be hopeful that these providers would welcome this educational program and assist in the formation of organizations that work to reduce the opioid crisis and keep their patients safe. Providers that were not compliant with the new requirement to complete these trainings annually would be unable to prescribe opioid medications in any capacity and could face further issues such as losing their licensure to practice if they did not complete these trainings. Although every state has educational programs revolving around combating the opioid crisis available to healthcare providers, there is not any evidence of any states or counties that are requiring providers to complete such educational programs. The educational programs are already available, so funding for the actual educational material would not be an issue. Funding for monitoring compliance would be the issue. Companies would be held accountable for ensuring physicians within their organizations are meeting this new standard of care. Policies and procedures would need to be formulated and put into place to communicate clearly what the expectation would be and consequences for noncompliance. It would also guide management in the monitoring and management of compliance and who to report these variances to, such as the medical board in which a physician is currently licensed. Funding for implementing these programs in the healthcare facilities could come from local and/or state programs. The Health and Human Services Program, which has donated over $1 billion towards the fight against the opioid crisis, could be an excellent resource. Another resource could potentially be funding from the Department of Justice. There was already approximately $582,000 directed to Douglas County alone from the Department of Justice for the fight against opioid crisis. These are just two potential sources of funding for the implementation of this program. In order for this program to work, several entities would need to be involved. First, getting the providers to comply is the most important piece. This would increase compliance and reduce the cost of running the program. Second, employers would need to be reliable in reporting physicians that are not compliant and enforce their standards of care for non-compliant physicians. Third, the licensing board for these physicians would need to be on board. It would also need to be the main enforcer of the program. It would also be beneficial for these programs to work directly with other community partners in fighting the opioid crisis. Pros of this program would be increased current evidence-based education for providers related to the opioid crisis and treatment of patients. Because providers are well known for their role in teaching and educating, this would greatly benefit other healthcare providers and patients. Patients would also benefit from the care from a provider whom is educated in the most recent evidence-based education, and the main goal is to save the lives of the patients, which is the greatest reward. Some of the cons would be that the providers are resistant to change their practice and their practice methods. Companies would be resistant to discipline providers for noncompliance. Licensing boards would be reluctant to make programs like this part of the licensing standard. And last but not least, the death rate from opioid-related complications would increase, and we would have a higher death rate. The last program that isn't currently being used in Douglas County is an increased access to naloxone. There are currently programs that have increased access to naloxone for healthcare professionals, but not much for access to naloxone by drug users, their families, friends, or others around them. The increased access to naloxone would save us. Other states are also working to implement these types of programs into their states and counties. One of these programs is making it standard practice for pharmacies and clinics to have standing orders to fill naloxone for anyone who comes to get a prescription. The patient would not have to have an exam prior, and Good Samaritan laws would protect the pharmacist if adverse outcomes were the result of filling such prescriptions in good faith. Another part of this program puts naloxone in the hands of friends and family of someone at risk for opioid overdose. This plan is referred to as the third-party prescription program. The program ensures that community members who are closest to opioid-addicted individuals have access to naloxone when they need it to prevent death from overdose of opioid drugs. Professional immunity and Good Samaritan laws provide immunity to medical professionals who prescribe and dispense naloxone medication, or to medical professionals or laypersons that administer naloxone. The next proposed idea would be to have naloxone available over the counter. Families and friends of addicted individuals and drug users themselves could have access to naloxone anytime they need it without a prescription. The pros of this three-part program would be that it would get naloxone into the hands of the most important people in the fight against the opioid crisis. This could be family, friends, users, or lay responders. It could literally save a substantial number of lives. A con of these would be the cost of the naloxone. Users and addicts are probably not willing to spend extra money on naloxone when they need to save it for their next fix. Another negative is the fear involved with dispensing and/or administering the naloxone, and being held accountable if there is an adverse reaction to naloxone. This could keep people from getting involved to this extent. Another negative could be that the addicts or users may push a limit on the amount of the opioid drug that they are using to get high, knowing that there is naloxone available to save them if they do overdose. It's like playing Russian roulette with their lives. The program would be funded by the same funding sources as the other two programs listed earlier in this PowerPoint. There are no programs currently like these in other cities, but there is legislature being introduced into law and hopefully passed so these programs can get started. The FDA held hearings on this issue in April of 2012, but the process to make a prescription drug available over the counter is lengthy and often expensive. The implementation of any or all of these programs could have great outcomes for patients, their families and friends, and for healthcare providers. Although there is always risk to implementing any new programs, it's not known how successful these programs can be if they are not implemented and monitored. If any one of these programs saves even one life, it's considered a success. In reflection, it's apparent that Douglas County and the state of Nebraska are diligently working to identify and implement many programs and regulation in order to combat the opioid crisis. This is a continuous fight, and it's apparent that cohesiveness on the part of all individuals in this fight is extremely important to its success. It is apparent that the fight will be a long and daunting fight, but made worth it when one life is saved by the interventions being put into place.